Okay, to get us started, here are some basic housekeeping tips. Oh wait, first, we would like to gather some information to understand who is participating on today's webinar. This is our first of 3 polls that we are going to be using today. So our first question is going to be poll 1, who are you? And I just want to share, this is my first time trying this out, so if it doesn't work, that's going to be okay. But I'm going to try to launch a poll. Launch. Okay, please enter your selection now. Great, so we have about 90% have voted. And now I'm going to close the poll. And it looks like we have 66% are early childhood providers, 8% collaboration leaders, 13% are cross-sector partners, we have 3% are state leaders, and 11% are other. And if you're an other, please feel free to enter comments in the chat box to let us know what system you're representing. Okay, our second poll is to understand where you are from. So which part of the state are you from? Are you from the central region, the southern region, northern region, or Cook County? So I'm going to open that poll and launch that. Great, we have about 95% of the folks have voted. Oh, and we have almost even distribution. That's very impressive. So 26%, we'll close the poll. Thank you. I'm going to close that poll. So 26% are from the southern region, 26% are from the central region, 26% from northern region, and 23% from Cook County. Wonderful. Okay, so here are some basic housekeeping. So today's session is being recorded and will be available on our Partner Plan Act website for future viewing. All of the participants have been muted until the Q&A section. If you encounter any technical issues, please use our chat box to send a message, or you can email Leah at leah.pow@actforchildren.org. Okay, so this is just a nice view of what the chat box looks like, so you can let us know stuff there. Okay, so today's presenter is Julia Zhu. She's our Community Systems Policy Director with the Governor's Office of Early Childhood Development. Most recently, Julia was the Early Childhood Programs Analyst at Children's Home and Aid. She also interned with the Ounce of Prevention's Illinois Policy Team. She was previously a Community Coordinator with First 5 California, focusing on underserved populations. Julia held an Associate Teacher Permit and has experience in both infant and toddler and preschool classrooms. She received her Master's in Public Policy and Bachelor's degrees from the University of Chicago. Welcome, Julia.
Thank you, Leah, and good afternoon, everyone. Thank you so much for joining us today. So I'd like to begin this webinar by going over some of the objectives we have. This webinar will present an overview of community systems and collaboration aspects of the block grant, including some examples of how communities have successfully implemented these strategies and links to additional resources. Before we get into that, however, I do want to highlight some resources that are available to applicants for the PFA, PFA expansion, and PI RFPs. The Center for the Study of Education Policy is hosting 2 workshops on professional development and technical assistance. These events have reached capacity, but you can still RSVP to be put on a wait list to receive future information. Additionally, there will be a webinar held on Friday, December 15th, from 10 a.m. to 12:30 p.m., and RSVPs for that session will open soon. So here's the outline for today's webinar. We'll start with an overview of the Illinois Vision for Early Childhood, highlighting young children with high needs and their families and strategies for reaching these families. Then we'll cover enrollment, comprehensive services, collaboration and community systems, the continuum of services from birth to third grade, and successful examples from the field. This webinar will close with additional resources and contact information. So we'll start with the early childhood vision for the state. The state has an early childhood vision that was developed through our Early Learning Council, a partnership between governmental agencies, private, nonprofit, and community stakeholders and service providers. So the early childhood vision for Illinois is for every child to enter kindergarten safe, healthy, eager to learn, and ready to succeed. Our state has a systems vision for equitable access, effectiveness of services, and sustainability and stability of services and the system as a whole. To carry out this vision, the following goals have been set out for the Early Childhood Block Grant: to increase the percentage of children who begin kindergarten healthy, safe, eager to learn, and ready to succeed. Decrease disparities in kindergarten readiness, and this includes racial, economic, and geographic disparities, and an achievement by third grade. All of this is for the goal that by 2021, 80% of all children will be fully ready for kindergarten. So the Early Childhood Block Grant has 5 policy priorities. The 5 policy priorities for the Early Childhood Block Grant are, as you see on the screen, prioritizing high-need communities, serving more children from priority populations, increasing the number of slots that meet the preschool expansion model, which is a full-day comprehensive services model, encouraging, supporting, and building community collaborations, and building the birth to third grade continuum of high-quality services. In Illinois, there are close to 1 million children under the age of 5. And as you can see from this slide, there are a significant number of children who have high needs. These categories include deep poverty, which is below 50% of the federal poverty line, children with developmental disabilities and delays, children and families who are experiencing homelessness, children who are involved with the foster care system. Poverty is defined between 50% to 100% of the federal poverty line, and children who are still learning English. The point to be made here is that there are many more families with high needs that are being currently served by early learning programs, and that's why we're prioritizing the enrollment of these populations in the block grant. The next slide highlights some data resources to learn more about children and families with high needs in your communities. In partnership with the State Board of Education, ICAM, or the Illinois Early Childhood Asset Map, has created a specific page on resources for FY18 ECBG planning. On this page, you can find local data on priority populations, early childhood slots, or seats, and kindergarten demographic data. In February, ICAM held a webinar to explain this resource and the reports that are available and how to find them. The webinar is archived on ICAM's website, and anyone can contact ICAM directly for assistance. We encourage local school districts, Head Start programs, and child care programs to meet together, review their local data, and plan jointly around slots and services. Illinois has developed weighted eligibility criteria around the priority populations that may be most at risk for later school failure. The highest priority populations are shown in dark green, and these include children from families who are experiencing homelessness, children who are involved in the child welfare system, children with developmental delays and disabilities, children with families who are below 50% of the federal poverty line. And the numbers in parentheses indicate the number of children reported for each of these categories in Illinois in 2013 as a reference point. Additional priority populations are listed in light green. So in order to achieve our state goal of preparing 80% of all children for kindergarten by 2021, we need to target the most at-risk children to ensure that they have access to high-quality early learning experiences. And we also need to connect these children to comprehensive services that include mental health, dental services, and economic supports such as WIC, TANF, and housing assistance. Often, early learning programs are most accessible to families with fewer risk factors, and so it's critical that we intentionally engage families with higher needs to make sure that services are available to them. So some early learning programs may be used to enrolling on a first-come, first-served basis, but we really want to emphasize that in order to recruit and enroll the most at-risk children and families, programs could utilize a multi-step cycle to prioritize families for enrollment. So the first step would be to recruit. The most at-risk families aren't really easily reachable through traditional communication methods, so they may need additional, and they also may need additional information about why early childhood services can benefit them and their families. They also may need additional time to obtain documents necessary for enrollment, and so the recruitment process should be flexible enough to address those needs. Recruitment of families could involve multiple approaches to cast the widest net possible to meet eligible families where they are. Some potential partners for recruitment could be healthcare providers, social service agencies, faith-based institutions, and food pantries. Strategies such as door-to-door outreach, targeted community events, and evening and weekend screening may also boost engagement of the targeted population. The second step is screening, or the way we're defining it in this context is to collect eligibility information for each family reached through these enrollment efforts. The state has a weighted eligibility form that can assist with this process, and if anyone has not had access to this form, please reach out to us and we'll make sure that that resource is available to you. It's important to collect the family's contact information in this step and also to maintain contact with these families on a regular basis to make sure that we can actually get them to enrollment. In communities with multiple early learning programs, they're encouraged to coordinate their screening activities together to reduce the chances of duplication of efforts. Next, programs should prioritize. After families have been screened, programs can prioritize families based on eligibility points, ensuring that families with the highest priority selection factors are immediately enrolled in a high-quality program. And last in this cycle is enrollment. Schedule enrollment appointments with selected families, assist them in obtaining documentation, and collect all the required documents to maintain individual enrollment files. Additional webinars and resources will be posted to the ISB Early Learning webpage regarding recruitment, enrollment, and screening strategies. So next we'll talk about some of the specific strategies of the Early Childhood Block Grant to achieve the early childhood vision for the state. The first strategy is to increase the availability of comprehensive services. In order to meet the needs of families from the priority populations, program needs to design and implement an array of comprehensive services to place children and families on a path towards success. Each family should be connected to medical and dental homes. Programs should offer social emotional screening for all children. In addition, medical health professionals, staff, or consultants should be available to observe in classrooms, provide consultation and training to families and staff, and facilitate referrals if necessary. Programs can also assess families' other needs and refer them accordingly to economic supports such as housing assistance and public aid. Comprehensive services are important because families with high needs have complex lives that call for comprehensive supports and integrated, seamless systems. These integrated systems should include services and supports beyond those that are offered by just one sector program or agency. Programs should seek to establish collaborative partnerships to support active, mutual referral of eligible children and families to the early learning program and from the early learning program to supportive services as necessary. It's important to know that collaborative partnerships are more than just an MOU. They require arrangements for the family's informed consent and data sharing between partners, and ongoing communication between the partner agencies, which include prompt response and feedback on referrals. So now we'll talk a little bit more about community systems and collaboration. In this diagram, you see a paradigm that was developed by the Build Initiative's Early Childhood Systems Working Group. This diagram provides a framework for thinking about a comprehensive early childhood system. In the blue oval, you see the strategy for early learning and development. And in fact, this is actually the purpose of the Early Childhood Block Grant, to strengthen this particular goal: nurturing relationships, safe environments, and enriching experiences that foster learning and development. The red oval shows health, comprehensive services that promote children's physical, developmental, and mental health. And lastly, the green oval represents family leadership and support: resources, experiences, relationships that strengthen families and engage them as leaders, which will enhance their capacity to support their children's lifelong well-being. Thriving children and families are at the intersection of these three systems. So while early learning or school readiness programs may be the most direct focus of early learning programs, these also play an important role in ensuring that all three of these systems work together to support children and families. We're going to go ahead and talk about some types of collaborations in the Early Childhood Block Grant. And programs are encouraged to think broadly about the potential partners in your communities. So these might include Head Start grantees, community-based early learning programs, home visiting, or other programs serving children and families, such as health. In order to accomplish our state's goal, grantees will need to collaborate actively. And there are multiple ways in which programs might consolidate funding streams in order to accomplish this goal. So we're going to share an overview of 4 potential ways: braided funding, partner relationship, coordinated intake, and shared goals. On this slide, you'll see an example for the braided funding model. So grantees with existing funding streams may look at these streams and consider ways to braid funding to support and increase program quality and capacity. In this particular example, there are 2 sources of funding that are combined to support one full-day program. The program here directly receives funding to expand from part-day to full-day expansion. And this program would track funding from both funding sources and then be accountable to each funder. On the next slide, you'll see an example of a partner relationship. So a grantee may choose to sub-grant funds to community-based organizations or private early learning centers to create new or enhanced classrooms in the sub-grantee's existing facilities. This approach allows grantees to extend their reach to target underserved community areas without building and operating new facilities. In this example, ISB grants funds to a community-based organization or school district. If we follow the arrow to the left, we see that this grantee can partner with a high-quality early childhood program guided by a written agreement. The partners together implement the program model with quality and fidelity. Grantees on the left, sorry,
The other left.
on the other left, if we follow the arrow, if we follow the arrow to the right, the grantee can also continue, to the left, the grantee can also continue to directly operate their own high-quality program.
Okay, move forward.
On the next slide, we see an example of coordinated intake and referral. So a grantee may also partner with stakeholders in their community to develop a coordinated system of intake, with the goal to cast a wide net seeking out the most at-risk children and families, and connect children and families to the programs that best fit their needs. In this example, recruitment would occur through non-early learning partners, such as healthcare providers, WIC programs, homeless shelters, or child welfare agencies. The program could also work together to plan shared outreach and screening events in the community. And I know many programs throughout the state are already working towards this goal. Programs would then agree on a collaborative process for referring and placing families in early care and education programs that best fit their needs. And this could include referrals to 0 to 3 prevention initiative programs, home visiting, early Head Start, as well as other 0 to 3 programs and Head Start. So here's another look at the same partners on the previous slide. It's important to note that the same partners that provide referrals to early learning programs can be your partners for providing comprehensive services. The relationship should be mutual and bidirectional. Next, we'll look at how a model of shared goals could work. Some communities may choose to not engage in a more formal coordination or collaboration that involves exchanging funds or changes to enrollment procedures. These communities, nonetheless, are likely to be still aligned around some key goals to advance opportunities and outcomes for children and families. Applicants should seek opportunities to enter into more informal partnerships across their communities to share resources and best practices to coordinate whenever possible. So the final component or strategy addressed here is the Continuum of Services from birth to third grade. This is defined as a coherent set of educational experiences and supports for children, families, and the professionals and organizations that serve them. It allows children to maintain and expand upon the gains they make in early childhood education, preventing fade out during the elementary years. This visual shows 8 ways in which programs can work to support continuity and alignment through community partnerships, comprehensive services, family engagement and parent leadership, supported transitions, joint professional development, aligned curriculum and instruction, aligned assessments, and data-driven improvement. For example, supported transitions refer to systematic, intentional, and warm handoffs between programs. For example, between home visiting and preschool. Another component shown here is aligned curriculum and instruction. One way to achieve this is to bring together preschool and kindergarten teachers to observe each other's classrooms and ensure that their teaching methods and curricula are connected and consistent. There are many ways in which programs can work towards birth through third grade continuity, and more information and resources can be found on the Illinois State University link that is shown on the slide. Next, we'll move on to some examples from the field. There are several examples from communities that are building and strengthening community systems so that more families with high needs are enrolling in high-quality programs. On this slide, you'll see a list of partnership examples from the field. The programs that are highlighted here are Innovation Zone communities, and as you can see, they've really worked to intentionally build partnerships with all of the systems available to their communities. I just wanted to give a few examples of specific ways that this has been accomplished. For example, the Altgeld Riverdale early learning providers in the city of Chicago are partnering with a health center in their area to directly refer children with high needs to early learning programs. Additionally, in the greater East St. Louis area, early learning programs have worked with their local WIC program to conduct screening and referrals in the waiting room of their WIC office through December 2016, when the budget impasse reduced their capacity for these partnerships. However, they know that this is a type of strategy for enrollment that they need to prioritize. So as a community, they continue to offer place-based screening at housing offices, community centers, and at the library during their enrollment initiatives. The Southside Early Learning Network in the Englewood area of Chicago is working with their network of home visiting programs to transition families with high needs from home visiting to early learning programs when children turn 3 years old. And each of these programs have built an intentional transitional plan so that the system can support families through warm handoffs. In all of these examples, early learning programs are working together with each other and with well-established services that already reach families with high needs to build enrollment pipelines into early learning programs. These are just a few of the ways in which programs can build stronger community systems to attain better outcomes for children. So for those of you who are looking for more resources, we encourage you to visit ISBE's Early Childhood page for additional information and resources, including archived webinars, upcoming professional development sessions, sample job descriptions, and other tools for best practices. There are a wealth of information available on this website, and please check the website frequently for updated information and resources.
And then what we can do is we can actually open up that website so that you can take a look, and we'll see if that is able to show. It's not going to show. Oh, you're right.
That's okay.
That's okay.
I'm sure people can figure it out.
Okay.
So those are the materials we wanted to share with you today, and we're going to take this time now to open up for some questions.
Okay, so I think, so as I was saying, this is sort of my first time managing the kind of hand-raising system, so I can pop open the questions, so I can see if anybody has a question. You can put that into the chat box. And what I also would like to try to do is, if you raise your hand, I believe that I can call on you, and I can unmute you so that you can ask a question to the whole group. So Penny, it looks like you have a question. I'm going to try to unmute you. I'm going to try to talk and see if that's working.
So I see a question here in this chat box. Where do I find the form for weighted criteria for prioritizing children for enrollment? That is available on ISB's website, and we're also going to make sure to send that form out to you right after this webinar. I'm seeing another question from Julie Schuckman. With braided funding, can you have a classroom with all-day services funded by both Head Start and PFA expansion? I believe that is possible, and I'm thinking of a specific site where I think I've seen that. Leah, do you agree?
Yes, I believe that we have that in the South Suburbs, actually.
Yeah.
Okay. Penny, I tried to unmute you, but I think what you can do is if you could type your question in. I also see that Carol Bennett has your hand raised, so you could.
Thank you.
Oh, there you go.
No, I do not have a question. I do not have a question. Sorry.
Oh, okay. Is this Carol?
Yes.
Okay, thank you. So I'll mute you again, and I'll unraise your hand.
I see a question from Tanika Jones. Guy, we will be sending out the PowerPoint after this presentation. Do we have any other questions?
No? Okay, so what we'll do is we're just going to close with the poll here. Oh, let me see. Let's leave that open here for a few more minutes. I know sometimes it takes a second for people.
So I see a question from Carrie Cox. If we currently had 2 half-day PFA programs and we want to move from 1 full-day and 1 half-day program, do we complete the expansion or regular RFP? I think so this webinar is not a TA session for these RFPs that are out. That information will be made available to you, and Carrie, I think I will just direct you towards some of the TA providers for the RFPs. If you send me your contact information, I'll make sure to connect you via email.
Maybe in the chat box I can type the TA email address. Isn't there a TA email?
I think it's ecbgta@gmail.com or something.
So we're going to answer. Amy, you have a question there. I'm going to let Julie answer that while I look up that email address.
Amy, I see your question. How do you go about setting up strong systems? I think that's kind of the name of the game here. Well, to answer that question generally, I think you really begin by looking around your community and getting an idea of what needs are there in the community, making sure that you engage families and agencies that are able to provide services to truly understand what the goals of your collaboration should be. And then moving on from there, you could also do an asset map, which would get you an idea of what kind of services you're able to provide. And then really it's a matter of building trust and relationships, being open to communication. I'm not sure if I'm understanding your question.
Sure. This is Leah. What I might also add to that answer is, I think, Julie, you gave a really good response. When we think about strong systems, kind of to those ovals, the blue oval is the one that we really do want to make strong, a strong early childhood system, while also linking and connecting those other systems. As early childhood providers and as a field of early childhood, we want to make sure that the children who need to be served are being served. So that's some data that you would gather by working with your school districts, by working with your different partners. Are children from priority populations being served by the programs that we have? Do we have programs located where families can access them? Are the programs that we have in our community of high quality? So those are some questions to ask as kind of an early assessment. So what does a strong early childhood system look like? It looks like we have the right programs for the right number of children and that we're serving children who are high need. And then we're also having good transitions between programs to make sure that children who might be in a home visiting program then get connected to a high quality early childhood program who then get connected to a kindergarten program, for example. So that's one type of system. Other types of systems, so for the overall kind of community system, you're thinking, do I have relationships with healthcare providers right now? One of the tips that we've shared over the years, whether that was through innovation zones or through some other training that we've provided, is a community would take a look, make a list of all of the priority populations, and then think about who those organizations are that serve those priority populations. So public health departments, refugee programs, homeless shelters, child welfare systems, teen parent service programs. And then you ask yourself, do we have relationships with those partners and those programs? Does anybody in our collaboration, does anybody in my school, do they know someone at that site? And how do we start to build and foster relationships with them so that we have strong, as Julia said, kind of bidirectional relationships? So that kind of system of engagement, that system of connection and relationship building is your second step.
I also wanted to point out that this particular webinar is one in a series that really address this fundamental question of how you go about setting up a strong system. And after this presentation, we'll send out the links to the website where the other webinars are archived and where you can get the dates and information for upcoming sessions.
That's right.
Any other questions from the attendees? So Adam Favre had a question about where we should go to get access to the other RFP webinars. Those webinars are on the Center for the Study of Educational Policy's website. We'll send out a link as well to those webinars.
Center for the Study
of Education Policy. Maybe we can go to the poll now. If there are no more questions, we will go on to the closing poll. Okay.
Okay, thank you, Julia, for sharing this helpful information. Our last poll that we wanted to do is just to see how valuable we found today's session. Oops. Okay, so I'm going to launch that poll. So not valuable, slightly. Okay, great. So I'll close the poll. It looks like we have a nice range here. So 16% for slightly, 35 moderately, 32 valuable, and 16 for very valuable. We always encourage you to add in your comments any tips for how this could be more valuable. We really engage in a continuous quality improvement and are curious to know how we can make this better for you. I want to share just additional information for you. If you're looking for more ways to engage, we invite you to attend upcoming policy caucuses that are being hosted by Illinois Action for Children's policy team. Each year, Illinois Action for Children convenes early childhood community leaders and advocates for early childhood policy caucuses. This year, we are hosting 4, and we have 2 more left on the calendar. Hopefully you can join. At the regional caucuses, people will learn about upcoming state and federal early childhood policies, including the status of the preschool expulsion legislation, the Children's Health Insurance Program, Child Care for Working Families Act, and more. You will get to talk about policy issues that matter to you and help inform Illinois Action for Children's policy agenda for fiscal 19. The regional public policy caucuses are also a great way to network with other leaders in the early childhood field. So you can register for a policy caucus by going to our website, and I'll also send that along as well. The content for each caucus is the same. You just pick one that works for you, and then registration is $15 to cover the cost of a meal. There's one taking place in Schaumburg tomorrow from 10 a.m. until 1:30 at the Schaumburg Park District, and another one in Chicago on December 14th from 5:30 to 8 p.m. That's taking place at the SEIU Healthcare. So we'll make sure to have that information for you. What I encourage you to do is to go to our website, partnerplanact.org, and to look at the events page. So what I'll do is I'll add that into the chat to make that easy for you to find, and we hope to see you there.
Great. Thank you so much, Leah, and thank you all for viewing this introductory webinar. For more information, please contact me at the Governor's Office. You'll see my email on the screen, or you could reach out to the Early Childhood Division of the Illinois State Board of Education, or Leah Powell, and her email is leahpowell@actforchildren.org. So thank you, everyone, and have a wonderful rest of your day.
Thank you.